Greetings. My name is Latrice Rollins, and it is an honor to be here to share about my book, Engaging and Working with African American Fathers, Strategies and Lessons Learned. I am an assistant professor at Morehouse School of Medicine. I work in our Department of Community Health and Preventive Medicine, and also in our Prevention Research Center. And I'm very passionate about health equity, very passionate about making sure that African American fathers have access to the same level of services that we provide to mothers and children. So it's definitely about serving the whole family. And this book is one way that I contribute to ensuring that we have those services available for fathers and their families. I want to just briefly share a video that was done by the publisher about the book and just give you a feel for what the book covers. That was just a brief video to cover and give an overview of the book. I'm going to put the link to my website and a direct link to the book in the chat so that you will have it. At this time, they are having a back to school sale of 20% off of all the books. So you already kind of automatically have a discount of 20% off of the book. So if you go to that link and go to purchase book, you will be able to get it. So just stepping back a little bit, the book really is a work based off of my doctoral research. I did a study looking at African-American women who work with African-American fathers in various fatherhood programs, or whether it was child support or parenting interventions, just different things like that, because again, I'm very passionate about making sure that fathers receive the same services as mothers and children. And a lot of the literature talks about how fathers are systematically excluded from services, whether it's based off of policy, whether it's the lack of inclusion of fathers in research. And we definitely know, like I said, there's a lack of inclusion of fathers in practice. And I find that that also stems from education. So if we look at our health and human services fields, whether it's social work or public health or however, if we look at the curriculum, there really isn't a lot that is shared about African-American fathers or how to work with them, how to engage with them, at least not in a positive sense. There aren't a lot of case studies that just talk about, your ordinary dads that you will encounter in family services and how to work with them. For the most part, if there are case studies about dads, they're typically in a negative sense around substance abuse or around domestic violence or something along those lines. And so I wanted to be able to share the stories of women in particular, because we know that the majority of health and human service professionals are women. And so how do these women form effective, positive, helping relationships with men that they encounter in various fields and in various services? And so each chapter of this book talks about a specific type of dad in a particular setting. And it goes over, kind of the history in terms of research or policies that affect that particular type of dad, and gives a case study from the practitioner who either authored the chapter or co-authored along with me. the particular chapter about the dad. So they give a case study, and then, what were some of the programs and interventions that were used, and what were some lessons learned from the interaction or from working with these types of fathers. And so when I say these types of fathers, I really wanted to point out unique areas or areas that we don't typically think about fathers in, such as maternal and child health. Just the name alone, maternal and child health, you typically are thinking about pregnant mothers, infants. You're not thinking about fathers, but obviously there has to be a father in the picture for there to be a baby and for there to be a pregnant mom. And so how do we work with those dads? And so there's a chapter in the book about that. Also thinking about fathers who are caregivers. So we have, particularly in the African-American community, a disparate amount of individuals who suffer from or are living with Alzheimer's. And so we have men who are taking care of their wives, or they're taking care of their parents that are dealing with Alzheimer's, and often they don't have a lot of resources or services or support for them. And so there is a chapter in the book that talks about working with these fathers. And again, a case study that talks specifically, gives an experience of a father who had to take care of his mother who was living with Alzheimer's. Also chapters about fathers who are homeless, who are veterans, fathers who are experiencing mental health issues and are reaching out for support. So again, each chapter gives some research, gives some background about the different types of dads, and also describes programs and services for them, gives a case study, and then some lessons learned. It is unique in that the chapters are all authored by women, again, because our field is predominantly female, and we really want to be able to show other women in the field that you can engage fathers and that you should engage them in services. And here are some of the ways that these women have found to be effective for them. It does conclude with some overall lessons learned. It concludes with a model for engaging fathers, making sure you have the knowledge, you have the mindset, you have the attitude that is appropriate to engaging fathers in practices. And so it is definitely a resource for undergraduate, graduate, new practitioners, and even some men have found it to be enlightening and being able to see themselves in some of the chapters. But it really truly is for those that are going into the field to help prepare them, because it fills a gap in our current curriculum and current textbooks in terms of working positively and effectively with African-American fathers. So I don't know if there are any questions from our one participant that we have here, but feel free to unmute, or if you have a question, you can put it in the chat. And so again, the way to get the book is to go to the website, latricerollins.com, and there is a section there for the book. You can go directly to that. Also, I can be reached on LinkedIn at Latrice Rollins, or Twitter at Latrice_Rollins. And there's a number of different type of resources, different programs and things that I'm a part of that's lifting up the work with African-American fathers and how to better engage them in our services and research. Oh, okay. Is Hawks Blue, unable to unmute?
Okay, now I'm unmuted. Thank you.
Good. I was feeling lonely, like, oh gosh, just talking to the room.
Okay, just got a quick question. Does the book, well, as you talk about fathers, do you have fathers in different economic strata?
Absolutely, yeah. So it's not just focused on one particular income. So not all about low income or, anything. So it's very general in the sense of diverse types of fathers. So, particularly like thinking about the father that went to mental health therapy, that dad is probably middle income or so, but it's very diverse in the types of dads. Obviously, the homeless fathers, that's a different type of background and socioeconomic status. So yeah, I try to really, again, think about diverse types of dads, unique, different types of services that they may need, and talk with practitioners that are actually working with these fathers and get their perspectives on what are some of the best strategies and information about their programs and services. Again, just to add to the literature that we have. Sure, let me see.
Okay, one follow-up to that then. I think you mentioned fathers as primary caregivers, but do you have examples of fathers who are, head of household and primary caregiver, like single parent as a father?
Single fathers. I don't know that there is a chapter just for single fathers. There is a chapter around foster fathers, which is, again, another kind of unique type of dad that we typically don't think about. I feel like based off the different case studies that these fathers, for the most part, they are within a family. But then I think there are some, like with the homeless fathers, there's 3 case studies because we couldn't just choose one. They're very, very interesting. So there was one father who was a single dad and was raising his child. But for the most part, they're either married or partnered in the various case studies. So I think that's, really for me, that's my favorite part of the book is reading the case studies. And we're very intentional about including those because I think it's beyond helping the learning, it also fosters discussion in terms of, what other dads kind of exist in my community that are like this, that are looking for services and support. Would I address this situation the same way that this practitioner did? What other things could have been done? So and then there are, again, some people that just don't know or have even thought about these fathers. And so it gives them some insight into, okay, this is what they're dealing with. These are their unique strengths as well as their unique challenges and their needs for support. So that's my favorite part of the book, are the case studies. I think we've been told that the session will absolutely end and cut us off at 8:20. It's 8:13 now, but I can just, in our last 2 minutes, just kind of run through the table of contents. I would say very quickly that all of these women are women that I worked with either for years or had just kind of been referred to based off of the work that they do. So again, we have chapters on fathers in maternal and child health, chapters on working with fathers toward workforce readiness. So making sure that we are helping dads with employment and careers, working with dads who are Alzheimer's caregivers, fathers who are in prison, African-American fathers in schools, making sure that they're engaged, fathers in child welfare, that's the chapter on the lives of foster fathers, working with fathers in mental health services, working with fathers in battering intervention programs. And this one I was really excited about because I think a lot of times people hesitate to engage fathers because they have that negative stereotype of, well, what if the dad is abusive and these things and that. So I really wanted to include a chapter about that. And then, like I said, working with fathers who are experiencing homelessness. And so those are the different types of fathers that are talked about in this book. And I hope, again, that you all will get it. And I look forward to any feedback and questions that you all have about the book